Today I want to talk about a medical condition called myocarditis. You may have heard about it being referenced as a potential side effect to some of the vaccines. But what exactly is myocarditis and who does it affect? Let's start with the question, what is myocarditis? This is a medical condition that occurs when there is inflammation in the heart, specifically the middle layer of the heart, which is called the myocardium. As you can see in this diagram, the heart is made up of three layers. The innermost layer is called the endocardium. The middle layer is the myocardium, which is where inflammation known as myocarditis occurs. And then the outermost layer, which is a sac that surrounds the heart, and that's the pericardium. So what causes this inflammation? It's usually a viral infection. However, it can also be caused by other infections from bacteria or fungi or even by radiation treatment for different types of cancer. The most common symptoms include chest pain, abnormal heartbeat, and shortness of breath. But other symptoms can include fatigue, heart palpitations, feeling dizzy or lightheaded, a sudden loss of consciousness, or swelling in the extremities. In some cases, there are no symptoms at all. After 7 to 10 days, one can develop a very sharp chest pain. This is a very harsh pain and is most likely an indication the outer layer of the heart, aka the pericardium, is inflamed. That's a condition that's called pericarditis. So myocarditis and pericarditis are very similar, but they are each referring to a different layer of the heart that has become inflamed. As inflammation in the heart muscle continues, the muscle becomes enlarged, and this narrows the space between the muscle and the sac, or the outer layer. When a doctor or a nurse practitioner listens with a stethoscope, they will hear the enlarged muscle rubbing against the outer lining. This is known as a pericardial friction rub. If this inflammation continues, the immune system will send an arsenal of fighting cells, which are called inflammatory cells. They get sent to the aid of the infected heart. So you have a virus that infected the heart initially, which caused inflammation around the heart, which caused an immune response, and the immune response also sends inflammatory cells. Remember the cytokine storm? Essentially, what begins to occur next is you end up with more inflammatory fluid in the space between the muscle and the outer lining. This causes more constriction of the heart, and it becomes unable to relax to receive fluid or contract to pump fluid out to the rest of the body. So that's essentially a crash course on what myocarditis is. And there has been lots of conversation around the world concerning myocarditis as a side effect to the COVID vaccines. This is known as vaccine-induced myocarditis. It's very important to understand that gender and age has a significant impact when it comes to vaccine-induced myocarditis, specifically males between the ages of 12 to 30. Now I want to mention a study that was published in October the 6th, 2021 in the New England Journal of Medicine. And this study demonstrated that the highest incidence of myocarditis was seen in male patients between the ages of 16 to 29. Although most of these cases were mild, there were some moderate cases as well. One case was associated with cardiogenic shock. There have been numerous studies done in the United States that have demonstrated the risk of myocarditis in younger males that were given one of the messenger RNA vaccine, which would be either from Moderna or Pfizer. Although most studies have shown this to be rare, there is concern regarding this adverse event. A couple weeks ago, we learned that Finland, Sweden, and Denmark are no longer using Moderna for people under the age of 30. The Moderna vaccine seems to have a slightly higher risk of developing myocarditis when compared to Pfizer. This could be due to the fact that Moderna contains 100 micrograms of vaccine compared to Pfizer's 30 micrograms. In other words, Moderna has a much higher dosage. Data from vaccine safety studies in the United States has also suggested that Moderna's jab may carry a higher risk of myocarditis among young people. But even so, some studies suggest that the risk of unvaccinated children getting myocarditis, along with other complications from a COVID infection, is much more significant. A child's immune system is going to respond more robustly to the vaccine, so making adjustments to the dosage and frequency that they receive are two important factors to consider in order to mitigate their risk of getting myocarditis from a jab. Children getting myocarditis after a COVID infection was among the concerns that over the summer led the Food and Drug Administration to ask vaccine makers to increase the number of children in clinical trials. There was an article that you can read about in the New York Times, linked below, that was also published in October 2021. It discusses how some countries are trying out single doses for younger children, particularly boys. This is something that I'm sure scientists and researchers are looking at, given the incidence of myocarditis post-vaccination. This issue is also likely to be the focus of intense discussion when agency and advisors meet later this month to review the evidence for vaccinations of children between the age of 5 to 11. And to help put this into perspective, because I don't think a lot of people realize how many kids have been infected, but according to the American Pediatric Association, as of October the 7th, 2021, over 6 million children have tested positive for COVID-19 since the beginning of this pandemic. And that number keeps growing every week, which is to say that getting children vaccinated is going to play an important role in controlling the spread of this pandemic. And figuring out the proper adjustments to the dosage and the frequency of the vaccine will help mitigate a child's risk of getting complications like myocarditis. Well, I hope this gives you a better understanding of what myocarditis is and how it relates to the vaccines that we hear about so frequently. Press that like button if you found this information helpful, and let us know in the comments below if you have any other questions or suggestions on what you would like us to cover in the next video. Thanks, and we'll see you next week.